So first I'll start off. My name is Fiona, and I want to welcome you to this session on safe supply for adolescents and all the concerns and discussion points. I'm really looking forward to it. I also want to acknowledge that I thankfully and gratefully join you from the traditional, ancestral, and the unceded territory of the Coast Salish peoples, of the Squamish, Tsleil-Waututh, and the Musqueam nations. And I welcome all of you just because we do have a large group I see here that we're not able to go around and hear where everyone is joining us from, but we'd love to hear that on the chat on the side here. If you're more comfortable with using the Zoom chat, you can introduce yourself there with your name and where you're joining us from. If you're joining us from the conference site, then there is a question and a chat box also on the side, on the right side of the page. So you can input your questions there as well as your introductions and where you're joining us from. So welcome you to do that. All right, so this is looks to be a very popular session because I think it's a very important and a topic that's dear to my heart as well. And I am thankful that we have 3 panelists here that are willing, open, and very enthusiastic to share with us their experiences and their perspectives. So I'll start first by introducing Leslie McBain. She is the co-founder of Mom Stop the Harm, and this was an organization that she founded in 2016 to help advocate for a more compassionate and evidence-based drug policies. And this was after she had lost her only child to a drug overdose. She also is a family engagement lead for the British Columbia Center on Substance Use and a very active member sitting on various committees and panels, really advocating to make some changes to drug policies. So we're very grateful and thankful for her joining us. Welcome, Leslie.
Thanks, Fiona. Hi, everyone.
Hi.
Yeah, I think you introduced me, so I don't have much else to say besides that. And I just want to add, I have a parrot, and the parrot only has one room to be in, and so you might hear the noise. And if she's too noisy, well, I'll keep my audio off, but I might have to bring her over to me so she is quiet. Yeah, so great. Thanks.
Thank you. And then another panelist we have is Casey Dalzell. So thanks for joining us, Casey. She is the Executive Director of the Drug Toxicity Prevention and Response Program, and where she's taken a leadership role in this program within the PHSA, the Provincial Health Services Authority, and is to develop a strategic response to our toxic drug crisis in BC. And she has partnered with kind of the spectrum of those who are involved, from medical leads to peers to community partners, to coordinate efforts and to really make a significant impact based on the evaluation of quality data and evidence to implement and support improved programs. So welcome, Casey. Thank you for joining us for this program on the panel.
Yeah, no ads for me.
Okay, I'm sure we'll have lots to hear from you after. Yeah, and then also now I'd like to introduce our third panelist, Rachel McClellan-Carriage. And thank you so much for joining us, Rachel. She's really stepped into this role in heroic efforts too, so thank you. She is a Master's of Science student at BC Children's Hospital, and she has a research focus on pharmacology and engagement in high-risk behavior. But in addition to that, Rachel does have lived experiences with childhood adversity and chronic pain. And also she has worked for, I think, over 7 years with vulnerable youth and in helping vulnerable youth cope with trauma and also supporting them in finding resources and alternative means of coping and developing resilience. And I've met Rachel in our community advisory group and also as a junior scholar. So you're participating in so many different ways and bringing so much value to this conversation. So thank you, Rachel, and welcome.
Thank you. I'm not sure if I'm supposed to add something, but thank you. I'm very happy to be here. And it's so cool to look down and see the number of participants. So I'm very excited.
Yeah, me too. So I will try my best at moderating this. Please post your questions. We'll start with some general, probably thoughts on the topic from our panelists. And then just really for myself, I'm a research scientist at BC Children's Hospital, and I'm really passionate about working with the adolescent population. I collaborate with the school districts, so work with students in high schools to help develop early intervention and prevention programs and really understanding how to reduce harms of substance use and really support building mental resilience in our youth. Great. So let's start off with a general perspective question. We can go through for each panelist. Just along the topic of safe supply for adolescents, maybe a few words of thoughts just on the statement, kind of your perspective when hearing about, you know, we want to talk about safe supply for adolescents in this conference. You know, what are your general thoughts on this topic? And maybe start with Casey.
Sure. So I can give a little bit of background. So I've worked in mental health and substance use, excuse me, for a very long time, over 20 years. Started my career working, I actually started volunteering at Riverview years ago. That was where I started my career, and then that evolved into recognizing that there was probably more we should be doing in our mental health and substance use system. And so I worked with the early psychosis intervention program for a very long time and evolved into some policy work there. And then I worked in government, and my portfolio was youth and young adults. And so we were able to get services like Foundry out the door. So I would say I come at this from a systems perspective. And what I see in this is that safe supply just generally was part of a public health response, you know, when we declared this as an emergency. And so that's how I see it. I see it as being our public health response to the crisis, which unfortunately we're 8 years in. And I have talked to folks that safe supply, they say that it has saved their life. And then I've talked to other folks that say that it didn't work for them too. So I think for me, when it comes to youth and safe supply, I just don't think we're there yet. And I think that's my opinion on that one. I don't think we have enough evidence just yet. I know we're building our evidence background, but I think when it comes to youth, we have to consider the, you know, where they're coming from at the time. And definitely, I mean, I'm open to hearing more about the youth perspective on safe supply and whether they think it's something that would be relevant to their experience. But from what I'm seeing, the youth that are being part of the toxic drug crisis, you know, have kind of like in the previous sort of session that we were just in, are coming in with different complexities that we need to consider in this space too. And I want to do things that are very evidence-based. I also think about prevention and early intervention. And if it offers that, then I think that's great. I don't have enough evidence just yet to say, you know, one way or the other, whether I think safe supply is a solution for youth in particular. So there's my general comment.
Mm-hmm. Yeah, great. Thank you. Thank you for sharing that. And Leslie, would you like to share what your thoughts are?
Mm-hmm. Every single kid is different. And I'm going to use the word kid because that's what I'm, you know, comfortable with. But every single individual, adults and kids, everyone is different. The needs of every single one is different. So I don't want to generalize on this topic because I believe if a youth or a kid is addicted already, we must talk about safe supply in order to help them recover. We cannot just yank them off whatever they're taking, put them in, you know, in custody of, you know, a mental health facility or whatever looks like is going to happen. Kids need to be, need what they need. And we have to ask them, we have to listen to them, we have to understand them, and we have to approach it with a lens of what is going to be the best treatment, the best, say, intervention, or the best way to get them balanced and stable again. And that may include Dilaudid or some other, there's all kinds of drugs out there that are legal and prescribed that could help them, ease them off, and help them recover from addiction. In terms of drug use, you know, recreational drug use, it's going to happen, and there's not much we can do about that except educate. And so that's where I come from on it.
Mm-hmm. Okay. Thanks, Leslie. And Rachel?
I actually agree with a bit of both what Casey and Leslie are saying, where I do agree that I don't think that the evidence-based research is quite there yet. At the same time, though, I think that considering the importance of choice is super important to youth. And by essentially taking the choice away, we may potentially create more harm as well. And that's why I think that topics like today are super important to discuss, especially to consider so many different viewpoints, because I think that this topic is so complex and every person is so different that we need to really incorporate so many different viewpoints. At the end of the day, though, I really think that choice is so important to youth, in addition to considering, you know, accessibility and really approaching it from a respect and non-judgmental perspective of care. So.
Yeah, no, I agree. I also see someone asking a question just about defining what safe supply means in practice. And Casey, do you want to take that one as your definition of what safe supply means?
So I think our definition currently is a pharmaceutical alternative. That would be the word that we're using right now. And I'll just clarify, like, it's interesting because I think Leslie and Rachel, you guys both said it exactly. It is an individualized approach for somebody with an opioid use disorder. That's what it's for. So I would just say that would be, it's a life-saving endeavor for somebody with OUD. Again, I think it's something that a clinician needs to offer. So a pharmaceutical alternative in the space for working with somebody with OUD. I think that's probably as simple as it can get for a definition.
But, sorry, if I may, just to clarify, because I mean, certainly I've heard a variety of different discussions. So we're not speaking of them having access to, say, you know, illicit drugs in terms of safe supply. We're talking about a prescribed pharmaceutical alternative specifically.
I believe so. That would be my definition. Yep.
Yeah. Yeah.
I Absolutely. Think the definition. Sorry, we're trying to. We want to keep them alive, number one, and putting them in a situation if they have addiction to have to go to the street. Then that's why we're all here, really.
So like methadone, classically, is what we're speaking of. So.
There's other drugs. Well,
of course,
Casey can talk.
Yeah. I actually think Rachel could probably add more to it. This is kind of her area.
Potentially, I'm a little nervous on potentially kind of jumping in, but I potentially might be happy to let you two both take the reins on this one.
Just to clarify my point is because there's certainly lots of discussion about, well, you know, if someone is using heroin on the street and it could be contaminated, then let's get a safe supply of heroin for them. We're not talking about that for youth. We're talking about a prescribed pharmaceutical alternative.
So from my perspective, this is just my understanding right now. And again, I am not a physician. So, you know, we probably should have a physician on this panel to do this, but there are other opioid alternatives. So pharmaceutical alternatives to somebody who's addicted to an opioid. There are OAT options, opioid agonist therapy options. And then there are things that are I'm not sure what the right word would be, but I guess there would be ones that would be considered as a safe supply. So for somebody who's wanting to maintain their opioid use over time, as opposed to come off of their opioid use. So that would be my definition of this. And in many cases, when I've talked to adults in this space, because I haven't talked to youth in this space, but when I've talked to adults in this space too, often it is, you know, so that they can relieve the symptoms of their addiction, so that they have a choice in using, but they don't want to die from fentanyl. So this is their option for that. And they work with their physician to access that so that it's a safe supply for what they want to use. And I think for me, it wouldn't be, you know, offering illicit substances, no. Terrence, did that answer it?
Yes, yeah. I think we're, I think I'm understanding it. Yeah, thanks.
Yeah, I agree. I think the conversation has been around prescribed medications as a safer alternative to the toxic illegal drug supply. Yes, and I think that's what's being considered for youth, and that includes OAT, but various other substitution therapies as well. So Brett had made a comment about we have enough evidence that youth die from unregulated illicit opioids. Pharmaceutical alternatives of known contents and concentrations allow people to make an educated choice about what drugs and how much they're consuming versus the illicit supply with unknown contents and their amounts. So thank you for that comment, Brett. Okay. Hi, Brett. You wanted to add to the comments?
Yeah, I mean, I just, yeah, I would like to add with that like we know that people are dying from the illicit supply, which is completely unregulated. No one knows what it is they're using. We're finding new contaminants every day. We just found a barbiturate here in Toronto in there, along with benzos and tranquilizers, along with a variety of fentanyl analogs and nitazene analogs as well. That people being unwittingly consuming these things that they don't want, they don't know how much is in there, and people might be doing a point every time. They know that's the amount that they use. But if you then use a point that has all these different cuts and all these, not just cuts, excuse me, all these different contaminants, then you can't regulate your use. It's why when we have alcohol, we have percentage and everything. And I'd argue as well that when we're discussing a lot of this too, it's like we want like the safety and the stability for people. Like that's really what we'd like to achieve, is people to be safe, alive, and stable, and then help them find their way, whatever it may be. It doesn't have to be abstinence. We don't put abstinence as a demand on everyone in society. And so I just want to also make sure that we're really like framing this about what it is we want to do. We want to keep people alive and as safe as possible, and that the youth should be afforded that opportunity to be safe, just as adults would who are using similar substances. Well, I can just kind of leave it at that, but thank you.
Yeah, no, thank you for elaborating and for sharing that. And the point that was brought up too, this individual needs and basis. Like we really need to understand where the individual is coming from, what resources they do have, and how we can support that better. It is difficult to talk more broadly, but I guess also from another health policy and strategy standpoint and guidelines, then we need to sometimes talk more broadly, because it has to be something that's implemented and gather all the evidence and then weigh it to whether it's something that is made possible or not as a guideline as well. How about, let's talk about like resources for youth. And I want to address this to the panelists. What has been your experience in talking with youth and with their families? What types of resources or support could benefit adolescents who use opioids and that are currently not available? In your mind and from your experience of working with these families, with these youth in your conversations, what can be provided further? Leslie, would you like to take this first?
Sure. My experience is mostly with parents and parents who have youth struggling, kids are struggling. There's a couple of things several things going on here, but one is that parents often know something's wrong, but they don't know what it is. And their kid is not forthcoming. They don't want to tell their parents they're addicted. They don't want to tell their parents that they're using drugs. So parent education is really key for one thing. Parents, and I've spoken to parent groups before, and they really want to know. I mean, it's not like they're adverse to knowing how to talk to their child or how to approach the situation, but they need specifics, and they even need the language, and they need to know not to be judgmental or angry and all those things. So parent education is really key. And also, and having it, it's easy to say and hard to do, but having a good relationship, for parents having good relationships with their kids. Parents don't often know what it is that is, making their child want to feel better with drugs. They don't know maybe what's happened. Maybe there's been abuse. Maybe there's a trauma they don't know about. There's all kinds of things that need to be sussed out. I think too, we don't have in this country, in this province, we don't have the addiction specialists that we need. We don't have enough. You know, it's easy to say, well, what services should they have? Well, they should have all services. They should have a social worker. They should have an addiction specialist. They should have treatment options, all these things that we know will help, could help, but it's just not there. And so this is one of the big problems. We've never been here before as a community, as a culture, where it's so dangerous. Yeah, and then of course, what was the question again? What services do we? I think we also need, and this will come up again, I'm sure, in this session, but education for children, for kids from a fairly young age, grade 5, on drug safety, on mental health, actual mental health, and how to handle their own emotions and the things that we know are some of the things we know are drivers. There's lots of others too, but yeah, there are no services, to answer your question, that I know of. And Casey, you may know more, and Rachel, but we often have nowhere to. Parents will ask us, you know, what should I do? What can I do? Where can I take my kid? So I don't think it's out there.
Yeah, thanks. Yeah. So thank you. That was the question. It's about resources and support. Like what could be in place to benefit adolescents who use opioids and that currently not available. Casey, would you like to?
Yeah, I can add. I could say, I know obviously Foundry is a really great resource for folks. Quick access, you walk in, you can get support, lots of education opportunities there. So that's a good one. There's recent work through, so most of the work I will say has been in the past 10 years. So the expansion of resources for substance use for youth has been within the last 10 years. Prior to that, I think, you know, unfortunately, that exclusionary criteria was something that led, you know, a lot of youth down the wrong path because they couldn't get access to services when they needed it because their substance use, you know, they were asked to stop using, basically. And we know that when a child is using and probably in the addiction area, that's just not an option for them at that point. They need treatment to help them there. So there has been a lot of advancements. There is still current efforts. I think Child Health BC has just developed withdrawal management guidelines, which I think are great. Interior Health is working with BCCBC right now to try to figure out how to provincialize their harm reduction education. What they found recently was that they had offered up harm reduction education for youth, and the demand for their online module was just through the roof. So there is a need for more, I think, education. And I liked the comment in the chat too, because I think we have to be realistic. Youth are going to use substances. You know, if they're lucky, they don't end up in a problematic area, right? And it just becomes experimental. However, it's also far more dangerous right now. So I think educating them, for me, and making sure that they're armed is really, really important. And definitely there's been, you know, significant efforts. And so a lot of it is around making sure that it's out there. People often turn to schools for that education. And so there are efforts in schools right now. Some of them can be a bit stigmatizing. So there's still some programs out there, I think, that it'd be great to maybe move away from. But I've seen better ones recently, talking to people. And, you know, a few folks have reached out to say they just went through a really great one. So, and that's for family members as well. Yeah, so that's my add to that space.
Great. And Rachel, would you like to add to this point as well?
I think that accessibility to resources is incredibly important to youth, because if resources exist, but youth don't know how to access them, or if it's not easy, they may not. In addition to considering flexibility. I think a lot of resources, again, that while they may be there, they may be harder for youth to find, to continue to use, to continue to maintain, in addition to potentially having a rigid structure that may not suit the youth. And in turn may actually turn someone away from treatment and future treatment as well. So I think overall accessibility and flexibility within the treatments that do exist are really important, or at least improving them.
Yeah, I see a couple of comments here. Yes, we brought up about Foundry centers are filling the gaps, a need for resources separate resources from adult services, particularly in communities that don't have like a Foundry location, which I think currently there are 25, and it's slated to be, I think 10 additional Foundries are coming up in the near future.
I would just, oh, sorry, I was just going to say, I would just add to what Casey said around Foundry. Foundry is fantastic in most cases. Most Foundries are exactly what we need. And I'm ever so glad that the government is funding the building of more centers like that. In larger urban areas, Foundry is filled. There's a waiting list, there's waiting lists. So yeah, the Foundry model, it may not be perfect, but the one I visited in Kelowna was so fantastic. It just lifted my heart. So Casey, thank you for bringing some hope to this conversation, because I feel hopeless a lot of the time about this stuff. So anyway, I just wanted to throw that in there.
We also had a question from Andrea asking you to comment on the age range of adolescents. I think that has been a fluctuating age parameter, as I've seen too. But Casey, in the policies, what is, for the term adolescents, what is used there? Like, what would be the age range?
So yeah, so this is a complicated one. So in my experience, and back when this was part of my portfolio at government, and there might be a few ministry folks here, the age range based off of research, based off the current developmental stages of our youth, which shifts over the years, right? So adolescence was different 40 years ago. So based off where that developmental stages are for our youth right now, we defined adolescence between that 15 to 25 year age range. And that was just purely based off their developmental stages. So not purely, but that was basically where it was. Unfortunately, I think our services don't match that, because, and part of that is because of some of our legislation, right? The Infants Act versus age of majority. So there's a lot of language considerations in that. And that unfortunately creates that gap, right? Where services are bound by certain parameters that they have to work with that don't match up with youth development and adolescent development. So again, I don't want to this doesn't need to be the Foundry show, but again, that's why Foundry put that age range in, was because it was trying to line up with the developmental stages of adolescence at this stage. I could be totally wrong, but that was sort of what we built at the time or worked with at the time.
Mm-hmm. Great. Yeah, thank you for that. There's an extensive comment here from Elizabeth, so I'm just gonna try to process it. I guess the question is about how Safe Supply would work for youth with education, follow-up, caregiver support being informed, and the services that would be offered. So I guess it's more the continuum. So, I mean, Safe Supply being one, I guess, intervention, if you would say, or support, but I guess it's along that continuum, there needs to be so much more in place. So prevention and harm reduction education is a huge need. Yeah, so maybe this speaking to like the resource questions, like what else needs to be kind of established and wrapped around and provided for the youth. Would anyone on the panel want to comment on sort of how a youth who would be receiving Safe Supply, what other interventions or treatment or support that needs to be in place to sort of make that work well if it were to be provided to a youth? Oh no, Rachel, would you have some thoughts on this? Like, what would that look like? What services need to be in place? Have you seen it work well in, for example, even in the older adult population? Because I know you worked with vulnerable adults as well, who are part of the Safe Supply program. Have you seen it in cases where it was supporting the individual, what that looked like and what was needed?
I think the most important resource I saw was often counseling, and particularly non-judgmental counseling and affordable counseling, because while very thankfully, I feel like society, we're moving to a very much more open standpoint on counseling, it's still an incredibly expensive service and resource. And so I found that with some of the adults that I worked with, there were so many layers to unpack that it wasn't as simple as just combining resources. And like there were days where things went good, there were days where things went less well. And so I think that overall, considering counseling, I also think considering potentially elements of family situations as well, also considering additional types of trauma is incredibly important as well, in addition to both mental and physical health resources as well, whether that may be physio, whether that may be use of a chiropractor or use of additional doctors. My apologies, I'm forgetting the main question as well, if you could potentially care to repeat it.
Oh, no, just wanted to see if you can share from your experiences, individuals who were receiving safe supply, what needs to be in place to make it work well, maybe for these individuals that you have worked with.
Yes.
And can that be translated to youth, maybe?
Regulation is probably, sorry, one of the, I didn't drink water before this, my apologies, is one of the most important things. And also just consistency and potentially having overall goals of what this person would like within their own health and their own goals. Because I think that while a medical practitioner may have a different goal, someone who may be going through different experiences or maybe potentially using may have different goals, and to very much consider theirs in addition to overall improving overall health. But overall, regulation is super important, counseling, and just having an open discussion and feeling like there is no judgment, and that they can be open and honest, which I think is super important, particularly when you're dealing with safe supply, is you don't want anyone hiding anything from you. And if someone doesn't feel like they can come talk to you, you may miss some things, or you may miss additional health elements that may cause potential problems as well. So I think overall, just creating an environment where this person can be honest is incredibly important, at least from my experience.
Thank you.
So I can jump in a little bit on that, Fiona. I think Rachel said it really, really well. And I think the, research says that psychotherapies combined with their substance use treatment are key. I think a lot of the youth that are struggling with a substance use disorder right now, again, like have complex issues. So you need that individualized approach. And unfortunately, sometimes that does include housing, right? It does include those social determinants of health to make sure that they can make the decisions that they need to be able to make and feel safe and engaged with their treatment. So I think it is, it's not simple. There is no sort of silver bullet here. I think it is a very complex, individualized approach, but we actually need more options. And again, I don't think that there are as accessible options as we need. And I think there was another comment too, where the system is a bit complicated. And I 100% agree with that. I think we've made it complicated, even with the expansion of services over the past 10 years. It's just gotten more complicated for people to understand. And so I would say that while you need different options for a holistic approach to treatment, I think that we also need to make it very accessible, like Rachel said before, so people really actually understand where they can go for support.
Yeah. Yes, Leslie, I see how your hand is.
Hi, yeah, thanks. This is, I think, what we're talking about now is the crux of it, really, of how to support adolescents or kids. And I just wanted to tell a couple of stories. One is my son, who died 10 years ago, had some mental health issues such as ADHD, and he had dyslexia, and he was very high energy, and he was generally happy. But what he told me one time, well, he became addicted to oxycodone through a doctor's prescription, but he'd tried other substances before that. He said, he told me, Mom, when I take an oxy, I feel normal. And so that was like an eye opener for me. When he was, when he had, I was gonna say high, but when he was taking oxy, he was himself. He was funny, he was, popular, he was, loved life, generally speaking. So we have to look at I don't know if he ever had trauma in his life, none that I could see, but maybe he did, and maybe he didn't tell me. Then the other, just briefly, yesterday I was on the ferry coming over to Victoria. I had 2 parents come and talk to me privately about their youth, their adolescents who were struggling with drug use. And in both cases, one was trauma and the other was mental health issues. And if we don't, and it's like what Rachel said, there has to be the after support. First of all, even getting them to discuss with us, the parents, their issues is number one. And then being trusting of whomever they are, you know, if they can go to Foundry and then find treatment afterwards and all the things that are involved, if they trust the process. So we have to make sure that the processes that are gentle and non-judgmental, etc. And they have to go on for longer than we seem to have in our systems. I think that's mostly what I want to say is it is really often addiction has more behind it than just being addicted physically to a drug that's addictive. And that's something that we can only do if we have the trust of the person.
Yes, Rachel, I see you have your hand up too.
Just particularly with the comment on undiagnosed ADHD is particularly within my own research. That's something that I often see, and also within my own life, essentially being like late diagnosed ADHD as well, and having friends, and particularly within adults I've worked with, where they essentially, it's the exact same comment you just said of using drugs made them feel normal. And I think that in addition to considering very traditional elements of trauma, there also needs to be acknowledgement of other mental health diagnoses as well that we may not initially consider, that are still incredibly important, that may lead to drug use as well. Very, very interesting comment as well, because I've seen that very often in a lot of the populations I work with as well, where it's that comment over and over again, which is that essentially drug use makes them feel normal. And I think that's so important to consider as well, of while potentially drug use may not always be an escape, it may just to be functional. And I think that's incredibly important to consider as well.
You know, I'll just add one final thing here too, that I think, you know, what we know from research of the overdose cohort, right? So BCCDC tracks our coroner's data along with other data. We know that 70% of the youth touched MCFD. So we don't have any more contextual information about that, but that tells us this is a very complex issue, right? And so I think those additional factors, like Rachel said, are really important in this space.
Yeah. And along that point, just us knowing the experiences of those within the overdose cohort and that they were involved with MCFD, is there plans to look into those further in understanding those cases? Were they receiving any treatment? Were they diagnosed, or were there mental health complications, concurrent disorders?
So I can't see that there are plans, but there is plans to update the overdose cohort. But I think that there are definitely conversations happening around connecting in a little bit with MCFD to understand those youth a little bit further, to really get a sense of the characteristics, to figure out how we can prevent. So yes, there are conversations that are happening. I do think that there is a conversation about that overdose cohort and being able to expand the information that we have access to. But that's a very, very complicated information sharing, you know, conversation to be had. It's probably worthwhile.
Yeah, I think so. Definitely a lot of information within that data set that could be explored, but it's great. I'm glad those conversations are happening. I think we can find, some value there. I see there's a comment too about, safe supply for adolescents, and maybe, so Haley, I'm referring to the comment or question that you have about hydromorphone and maybe youth selling it, youth getting it from the street without a prescription. So that, I guess you're maybe referring to the kind of diverted drug supply and the concerns there with like safe supply. I know that there's some controversy about safe supply being diverted, and now it's ending up on the streets and maybe being more available, and youths are also purchasing it through that route. sort of, that's how I'm interpreting the comment. And maybe, I don't know if the panelists, you want to expand on any thoughts you have about diverted safe supply and a concern there. Yes, Leslie.
I would. What the research and anecdotally we learned about diversion is, first of all, and maybe most importantly, well, first of all, it does happen. But second of all, it has always happened. It has always happened. And the whole brouhaha around diverted safe supply, a lot of this narrative is being pushed by the small c, large C conservatives. They're weaponizing this particular dynamic. And it's always happened that youth, adolescents, kids will go into their parents' medicine cabinet. They will, somebody will bring diverted supply to, a party or whatever. It's always happened. Is safer supply, and I'm getting a little itchy around us continually using the term safer supply when we really should be saying pharmaceutical alternative. It's a mouthful, but that saying safer supply is misleading. And anyway, I just want to throw that in there. But so there's always been diversion. Is diversion causing more addiction around for adolescents? That's, I guess, our question here. Maybe. We don't think so, but at the same time, if it's safer supply, if it's pharmaceutical alternative that they're getting, they're less likely to get, the mixture that the young man at the beginning was talking about. They're less likely to die from toxic supply. Frankly, I don't have very many concerns over this particular. It is something we have to pay attention to, certainly, but I don't have as much concern and worry about diversion as I do around untreated addiction and drug use. And not everybody's addicted, as I think I said before. It can be at parties and gatherings, or somebody just at home and they're alone in their bedroom wanting to feel better for the evening, or it could be anything. So diverted supply, yeah. So it exists. It's not causing deaths, for one thing. Maybe one or two here, and then you hear about that for weeks on end in the media. It has happened, but it's not rampant. Yeah. Thanks.
Thank you.
I don't know if I have too much to add to that, Leslie, because I think you're right. I think it's being politicized, I think probably more than it needs to be. And what I'm seeing, unfortunately, because of the way that the media is coming at things, is that people don't feel okay speaking and bringing their opinions forward. And I don't think that is what we want. I think everybody's voice counts in this space. I think every perspective is, a good perspective. And there might be varying perspectives, especially in this space. I mean, anything in the youth substance use space is a hard, sticky subject, right? I'm a parent of a 14-year-old, so I can tell you it's hard to have that conversation with your kids. So I think it's important that we just make sure that it's okay to talk about it, and that we can respect other people's opinions in that space. It doesn't have to be a battle, right? And I know for me, I don't come at this from an expert. I certainly know how to work within the system, but I'm going to turn to others for their viewpoints and try to bring that forward as we do some planning.
Yes, no, thank you. Thank you for sharing those opinions. And we have a few participants, Brett, Abigail, commenting on that as well, that the comment about diversion is not driving overdose deaths, and that diversion is not as big of a concern as media and politicians can make it out to be. So as, echoing the comments that you have made. And yes, I think that point, Casey, about sharing our opinions, our experiences, and having voices heard. And I don't think we can meet needs until we know what the needs are. So I think that if we stifle the expression of needs, then we will never be able to even think about how to meet those. So yeah, I appreciate these very honest opinions and comments. Let's see. Now we still have some time. I thought we can talk about integrated system of care. I think that's something we touched on a little bit earlier. But I wonder if we could discuss what are the different components of an integrated system of care. And I know, Leslie, you alluded to earlier, there are things that we know that needs to be put in place or needs to be available, but they're just not there. And I have heard this conversation from previous conferences and other conferences that, and also, you know, it was even mentioned in the morning session that we need a lot of different things like supported housing, a continuity of care, earlier intervention, family support, social support. Then when it gets to that point, it's like, well, it seems to be a long list of things that we recognize individuals need. Maybe they're not there yet, but how can we move further? So what do we do to move this kind of one step closer to providing all these things that we've sort of repeatedly mentioned and discussed about how there are gaps and it's missing? How do we move into that direction? Who needs to be part of this conversation? Yes, Leslie.
One time, Dr. Evan Wood, who is a mentor of mine, said, he said, we shouldn't be talking about broken systems because we actually don't have a system. And this is adults and youth. Everything is siloed. The services are siloed. There's little, I'm not going to say absolutes, but there's little conversations between the silos of care. We need to have integrated care where there are the resources available when they're needed, and with all the wonderful different properties that Rachel and Casey and I have said around trust and openness and non-judgment and mental health and physical health and all those things, they have to be integrated. So, I mean, it's all aspirational. Who has to do this? The government has to put time, effort, and listen to the research and listen to what's right. And to me, that's the biggest barrier right there is government courage and will to make these things happen. We know what is right. We know that, I mean, I don't know everything, but I do know that youth and adults too need every one of these components at some point in recovery. So what was the question? Yeah, see, we get into our little rants, don't we, Rachel? I always forget the question.
Like how to move us into this
move us forward, right? Well, forward. I spend too much time on government committees, and I just hear the same rhetoric over and over again, and not a whole lot of movement. They say that they are providing more beds and more treatment and more detox facilities, and none of this seems to apply to youth. But at the same time, none of it happens on as quick a scale or a time frame as we need. We need it now. We need it before more people die, before more youth. And this is, I just want to throw in too, as we all know, this is a really terrible time in globally in terms of, you know, the future and what people can hope for and expect. And kids especially are feeling, I don't want to say hopeless, but they don't see a good future. So we have to attend to that as well, to their, well, again, it comes back to mental health and their comfort in their own bodies and all of that. So we need a whole lot more professionals who understand youth and that are accessible. And we just don't have enough. And even the foundries, we don't have enough. Yeah. And as someone mentioned in the chat, they are shorter term. They're a great starting place, the foundries. And it just made me realize I should have said that yesterday to one of the families that I talked to go to the foundry. But yeah, we just need more of everything. We need to attend to the youth. Otherwise, we're heading in a really dangerous, we're already on a dangerous trajectory, and it's just going to increase.
Mm-hmm. Yeah, thank you. Casey, would you like to share your thoughts on kind of
I mean, I think
forward?
Yeah, Leslie covered it. I would just say that there are, I mean, again, maybe I'm the optimist, right? I do think that there are, yeah, there are a lot of people willing to step forward, and there are resources coming out the door. I agree, there's not enough. I would also say that it's really important that we look back at the resources that we created over the past years to see the kind of impact that they're having. And if they're not having an impact, then how do we shift them? How do we make them better? And I don't think we've done that. I don't think that there has been efforts to look back at systems and services that were set up 30 years ago to see, you know, do they need to shift? Because I think that the context that we're working in now is shifted. Our youth are different. It's like you said, Leslie, they're dealing with way more stress, I think, for what life looks like for them than they ever did before. And so do our services need to shift because of that? You know, we know there's more ADHD, but we don't have ADHD services. So how do we make sure that we're matching with the clients that we are serving? So with the youth that we are serving, are our services meeting their needs? And we need to go back and check. We need to double check that the services that were created way back when are doing the job that they need to be doing, and also staying ahead of where the needs are. So I am optimistic. I think there's good people in the system doing great work, and it's going to cost a lot of money. I agree, and government will for sure.
Great, thank you. Rachel, do you want to share your thoughts on moving forward?
They both just hit the nail on the head, both of them. So yeah, I don't have too much to add. I think Leslie and Casey did a great job.
Mm-hmm. Yeah, we have a comment. We have a suggestion for a trial. And yeah, I like implementing research studies too. So maybe like a pilot study or trial for people that includes these things that we're talking about. I think there's probably some examples of that, but in a very limited sense. Housing integrated teams, counseling, safe supply, and enough time. So even follow-up, right? Longer term. Sometimes I think a lot of pilot programs are just what they are, pilot, and they're short, and we don't really have longer term information on individuals to follow them long enough. Yes, Leslie, you had a comment on that?
Yeah, I have a comment that it keeps occurring to me and I keep forgetting, but we haven't talked about Indigenous youth, and we need desperately to, and not me, but the government and all the people that are so strong within their community, the Indigenous communities, to be attending to the horrendous inequities here in treatment for youth and you know, in rural and remote communities in this province and across Canada. But here in BC, we talk about it a lot. We at Mom Stop the Harm actually worked with an Indigenous group to, and this is their word, not mine, and I think it's okay, indigenize our facilitator handbook for support for families. So we had created this this great manual for people who would lead support groups for people who had either lost someone or had someone struggling in their family. And then we had a couple of elders and a group, Karina Chase, if you know her, and several other people indigenize this manual. And it's the most beautiful thing. And it wasn't easy, but it didn't cost very much, you know, in terms of dollars. And it's being used. It's being used in communities. It wasn't that hard. And this makes me crazy, really, to see that the government is not attending, because, as we know, Indigenous folks and youth are widely overrepresented in the crisis. So just want to throw that in there, yes, because we need to think about that in slightly different terms too, and different approaches.
Yes. No, thank you. Thank you for bringing that up. And with a comment about other maybe subpopulations, newcomer populations, especially youth in rural areas as well, that have a lot of unmet needs. But a comment too about prioritizing connections and empathy is very protective. And that as a youth worker, this is where they like to start. Changing the systems is overwhelming, but helping kids feel heard and seen is equally important. So I think we need to work along the entire continuum. So those who can and work in spheres where they can influence the policy change, they need to dedicate themselves there. And those who have the contact and the relationships and the ability to support, then we can have our sphere of influence there. I agree with that, yeah. Okay, I think we're nearing our hour. I feel that was a nice, slightly more optimistic, positive way to end the tone. I don't know if there's any last words from the panelists or any other questions. I see a lot of comments on the side, but not so much as questions addressed to the panelists, but any last words? There's only a minute. Rachel, you didn't have a chance to share about the moving ahead question, but do you have any last words you'd like to share with the group?
I'm not too sure. I really do feel like Leslie and Casey just have pretty much said it all. I think overall, just accessibility, trust, and flexibility is just so important moving forward, because even while certain treatments may not work for an individual at the time, they may work months or years down the road. And so just continuing to have and improve that flexibility across the board is just incredibly important for moving forward.
Yeah, great. Well, thank you. And thank you for everyone's openness and honesty and just the ability to hear one another out. I know that this is a very sensitive topic, but I really enjoyed hearing all the perspectives and all the comments on the side. Thank you. I'm going to try to save the chat. I'm going to have a place within the our program to kind of save all the conversations or dialogue. And I see there's some links and information and papers that were also shared. So I don't want to lose that. So we're going to put that, and hopefully we can post that on the page as well. So thank you everyone for joining us. I really enjoyed this conversation. And I think moving forward, we have a lot of interesting sessions coming up. I know we have some youth experience panels as well this afternoon. Just a short plug in for that, and so many different opportunities for us to continue sharing and having discourse over this. So thank you very much. And we'll see you in the next session.